Now after the event, from a runner or triathlete, there are certain areas that have a high amount of fatigue. So you can certainly laser the areas that you did before the performance, but these are some areas that I found that are very successful afterwards. One of them is right here in the shin area and peroneal areas, also because of shin splints and a lot of high impact from running. So we'll do laser treatment into here with a massage ball, applying pressure all the way up and down on that tibialis anterior. And the next spot is the actual quad itself, because they use that a lot with biking and running. It really has a high amount of fatigue, and laser afterwards will remove a lot of that lactic acid buildup. So because it's a larger surface area, you want to increase your power and the amount of dosage that you have. So you can do the leg as it's straight. Make sure you get all sections of this, outside, center, and then medial. And if you want to stretch the tissue, you'll just have the client bend the knee a little bit. Then you can stabilize with your hand and then add a little bit more pressure to the tissue as it's stretched. This one, the athlete will notice a significant difference in improvement in post-race fatigue, or what they call delayed onset muscle soreness. Now, third area after the race is going to be the hamstrings. This is an area that's very, very tight on a lot of people, and they also have a lot of fatigue in there. So you can do the massage ball tip as well. Move up and down all sections of the hamstring, from the biceps femoris to the inner thigh, and go all the way down to where it crosses the knee. Change your patterns, side to side, up and down, circular. And this one you can apply quite a bit of pressure. If you want, you can use two hands as well, so you're able to deliver some deep tissue massage at the same time. And then you can obviously back this up with tape later if you feel this is an area that needs taping. After a race, to settle down areas that have a lot of impact and fatigue, you can do the shin region. So I'll start proximal, and I can work my way down actually into the top of the foot as well. So I have her in this position because I'm going to pre-stretch the tissue, and in order to stretch this further, she's going to plantar flex and invert a little bit. Just follow your line down. I'll come right into the top of the foot, and you can angle the tape so it just goes wherever you want it. Now, if they have a localized spot that's really, really tender, then that's the one where you can cut a decompression strip, and you can put that right over, and the decompression has that extra lifting effect. So it's pretty much right where it hurts. They say, okay, where does it hurt? They put their finger there, and then that's where you stretch 100%, back off about 50, put there, rub across the center, and don't stretch the ends of the tape. And now you have your shin. And then we can move right into the quad, the rectus femoris, which is another spot that has a lot of fatigue on there. This one you can start proximal and work your way distal. Either way, lay down my anchor point and then just stretch the tape down. And I can cross over that knee if I want a little bit, and then you're good to go for post-race recovery regeneration. The last area I tape after a race is the bottom of the foot, obviously because of the high amount of impact here, and plus the thickness of the fascia on the bottom of the foot. And this is an area that can improve flexibility all the way up the entire body when you put one single strip of tape here. And also it's a high impact area where people can develop heel spurs and a very painful condition called plantar fasciitis. This can help alleviate the symptoms of that or help prevent that from setting in. So with this one, you're going to measure the bottom of the foot, cut your strip of tape, and you want to stretch the tissue so the foot is like this, dorsiflexes the ankle, toes will extend. I'm going to start right here near the toes, on the bottom, lay my anchor point down, and then come right across that fascia and go right to the heel, and then we'll put a decompression strip right in the center. So lift in the middle, pull and separate. This one I'll put about 25%, so if I go 100, back off 50 and a little bit less, and put right across here. And that's going to give that lifting effect to the bottom of the foot. Wrap the ends around either side. And the athletes will tell you, you can relax your foot, that there's almost like a little bit more of a springiness in their step, and that's the elastic recoil of the tape to give you that little almost like ricochet rubber band effect. And of note that you can certainly do this tape job before an event as well, pre and